Good. Well, I'm here to talk about what every provider should know about oral health. I was really thankful that I was invited to speak on this topic. It's actually one that's very near and dear to my heart because I know a lot of medical professionals are scared of the mouth. It's a place that's kind of foreign and people don't want to look in there and it can be scary, but I just wanted to reach out to you guys and talk to you about what you should know and some of the highlights about oral health and dentistry. But yes, my name is Chole Stuck. I'm a general dentist and I'm also the dental director at your community health center in Rolla, Missouri. So let's get started. All right, so dental health is whole body health. Things that happen in the mouth can affect other parts of your body and vice versa. So when we think about dental health, I always think it's interesting that it's so separate from medical. It has its own type of insurance. It has its own, referral system. And there's a lot that we can tell as oral health providers about your entire body just from looking in your mouth. One of the biggest things is diabetes. With diabetes, often I can tell if a patient has it even without testing their blood sugar based on how their mouth looks. Diabetes presents orally with swollen and bleeding gums. You can have bone loss around the teeth, which is also known as periodontal disease or gum disease. Often people who are diabetic have more frequent infections in the mouth as well, known as dental abscesses. And also diabetic patients have poor wound healing, which we also encounter in the dental field from procedures that we do daily, whether that be manipulation of the gum tissue or extraction of teeth. We can see that their gums and their mouth doesn't heal as quickly as other patients. Also, sometimes patients who have diabetes will have mouth sores. So that's something that can indicate that they may need to be referred to a medical provider to check and see if they are diabetic, especially with type 2 if they're unaware of it from childhood. Another big section that relates dental and medical is cardiovascular health. With dentistry and cardiovascular health, I know here at your community health center, we check patients' blood pressure every time they come in for a visit, whether that's for an exam, a cleaning, or treatment. We monitor blood pressure and we see patients sometimes more often than they see their primary care providers. So we can kind of be a good source of catching early stage hypertension, elevated blood pressures, and things like that when patients aren't seeing a physician regularly. It's more common actually for people who aren't going to see a doctor to come see a dentist first because of pain in the body or pain in the mouth or head and neck somewhere. Another thing with dentistry and cardiovascular health is patients who have poor oral health. So they don't brush their teeth well, they have a lot of plaque and a lot of cavities and stuff. That can actually affect your cardiovascular health by increased risk of bacteria in the bloodstream. There are lots of studies that show that bacteria can be transient when you're even flossing your teeth or brushing your teeth and can cause problems with heart valves, especially patients who have artificial heart valves. So that's something to keep in mind when you're thinking about dentistry and the heart. A third big category that's something that's just kind of starting is Alzheimer's. So a study from Harvard University back in September of 2019 actually showed that with patients who have poor oral health, there's a specific bacteria, P. gingivalis is the name of it, but it is present in patients who have periodontal or gum disease, and that specific bacteria can travel to the brain through the bloodstream. And when it gets to the brain, it can release an enzyme that actually damages the nerves in that area. So there's still a lot of studies going on, but there's definitely some connections with poor dental health and Alzheimer's. So this is definitely something that we are looking, further into. And I always like to let medical professionals know that dentistry is not just the mouth, it affects every part of your body. And these are just three of the biggies. All right, so what about kids? Kids have their own set of teeth. They get 20 baby teeth that will eventually be lost by the time they're about age 12. Children usually develop teeth starting at age 6 months to 1 year old. They start coming into the mouth at that time. They actually develop prenatally, but they erupt from those ages of about 6 months to 1 year old. And you continue getting teeth even through your adolescence that are going to be your baby teeth or primary teeth. But a lot of people think, oh, they're just baby teeth, we don't need to take care of them. But that's definitely not the case. Oral health with children is almost more important than I would say adult dental health because it sets the stages for their adulthood. So it's not just about preventing cavities. Speech issues is something that is commonly treated in both a dental and medical setting. We do a lot of referrals back and forth. One of the things we see a lot with young kids is if they're tongue-tied, they can have trouble nursing, they can have trouble learning how to speak, and that's something that we get a lot of referrals back and forth between OBGYNs and other medical professionals about. Another thing is crowding of the teeth. If you have severe crowding or severe deformation of the jaws, they can have trouble with speech issues, and that kind of leads into braces or orthodontics. Orthodontics is a specialty of dentistry, and it's one that the pediatric or children dental health really plays a part in. So we see early intervention is the biggest thing. So if a parent or a medical professional was noticing that a child wasn't eating right or wasn't able to speak right or was having trouble in school with, talking or sharing presentations or something, that it might be something that they could have a dental issue with. So that pathway of referrals and working between those professions is really important. Another thing with children's dental health is the age 1 visit. So this is something that a lot of people don't know about. The American Academy of Pediatric Dentistry actually recommends that children be seen by a dentist when either they have the eruption of their first tooth or by age 1. A lot of people think that that's too young to go to a dentist, or that they, what are they going to do at that age 1 visit? But it's more about talking to the guardians and the parents than it is actually talking with the kids and showing them anything. I really want to see kids as soon as they have their first tooth or by age 1, just so that we can talk to the parents about the correct way to clean the teeth, home care, talk about diet, nutrition, what kind of things is the child, having in their mouth. And then we can also talk to them about the development of their teeth. When should they expect certain teeth to be coming into their mouth, and kind of check for those normal things. And the age 1 visit is something we work with a lot of OBGYNs with, or family medicine doctors with. So it's very important that kids get in early and that we talk to parents about how to prevent decay from happening in the first place. And then the last piece I have on this slide is baby bottle decay. And this is something that happens quite frequently when kids aren't, getting that education, when the parents aren't getting the education about what causes cavities, what can they do to help prevent it. Cavities, just so everyone knows, are caused by sugar, the acid that your teeth, the acid that your saliva produces, and then when that sugar and acid mix, it eats away at the tooth. So that's kind of what happens. So carbohydrates are kind of your tooth's #1 enemy. And with baby bottle decay, what we see happening is a lot of times parents or guardians will put children to sleep with a bottle of breast milk or formula, and the natural sugars or carbohydrates in that formula or breast milk will sit on the teeth all night, and then they break down and cause cavities. So I actually have a picture of that on the next slide. So here you can see the levels of decay on pediatric teeth. In the early decay section, those little black arrows are pointing to little white spots. And those white spot lesions are the very beginnings of cavities. At this point, those white spots, when we look at them, they appear chalky. They might be less shiny or more rough than the natural enamel or outer layer of the tooth. And on x-rays, they might show up as slightly darker or demineralized in those areas. So this is something where if you catch it this early, you can actually reverse those white spots so that they don't become cavities. There are two layers to the teeth. There is an outer layer of enamel, which is the hardest substance. And then underneath that enamel layer, there is a softer layer called dentin. Dentin is what protects the nerve, and the nerve is the third layer of the tooth. So once cavities get that deep, there's not too much we can do other than root canals and taking teeth out. So in the moderate decay section, you can see that those white spot lesions have become brown, and now they are cavitated. So that first layer of the tooth, the enamel, is completely missing. And if you were to touch those areas with an instrument, they would be very soft. Oftentimes at this stage is when we see kids for the first time, if their parents, get concerned because they start to have these brown spots on their teeth, and they come in, and they can still be fixed at this stage, at the moderate decay stage. We can do fillings with local anesthesia in the area, or sometimes if the decay is covering a larger portion of the tooth, we can actually do a crown on that tooth for pediatric patients as well. And then on the final area of this, you see advanced decay. And we do see quite a few children who come in and have this type of decay. It's where it is on every surface of the tooth, and it's very dark black. These teeth often sometimes have infection around them where the decay has gotten into the nerve of the tooth and caused an abscess. And these teeth often have to be removed. So when kids lose teeth at an early age, it isn't just their baby teeth that's affected, it's their speech, their eating. It can actually affect how the permanent teeth will erupt later on when they're supposed to get those permanent teeth. The front two teeth in children on the top often are lost around age 6 and 7. So these kids will have these teeth for quite a long time and have to take good care of them until their permanent teeth come in. So the good news is this type of decay is preventable with talking to parents at the age 1 visit, good oral hygiene, and modifying their diet to what they're eating and taking to bed with them. They can really help prevent a lot of these things. All right. So what about before the kiddos are born? How about pregnancy? One good thing to know is that the majority of dental treatment is considered safe during pregnancy. It's not something where women need to avoid coming to the dentist when they are pregnant. We actually encourage pregnant women to come in. It gives us a chance to not only take care of them, but to also educate them about their baby that will soon be born and their dental needs. Digital radiographs are something that the majority of dental offices are using now, and the amount of radiation with dental radiographs is significantly less than traditional film radiographs or x-rays. So that's something. We always use shielding of the thyroid and abdomen with any patient, especially pregnant women. Sometimes double shielding is used for them. And then the biggest things with pregnancy too is there are changes in a woman's mouth during pregnancy. There's a lot of hormonal changes and diet changes. So with hormonal changes, we actually see gingivitis being very prominent in pregnant women. And it's nothing that they're doing wrong. It's not that they're not taking care of their mouths, but it's just that those hormones cause enlargement of the gum tissues and bleeding of the gum tissues, and just extra care is needed during pregnancy. So we really want patients to know that that's a normal thing that happens and that they should just keep seeing their dentist for routine dental treatment. Also, diet changes can increase the risk for dental problems, especially tooth decay. A lot of pregnant women have different cravings or have morning sickness, acid reflux, and those things can be pretty damaging to the teeth and require extra treatment or different types of care during their pregnancy. So it's kind of an old wives' tale that you lose a tooth for every baby you have. It's definitely false that babies do not leach or suck calcium from the mother's teeth. But I do think that that wives' tale comes from a bit of truth, because you are more likely or more at risk for dental decay when you're pregnant. So that's why we just say you need to take extra care when you are pregnant and come in for dental treatment. So definitely down your career path in the future, if you know are seeing pregnant women, make sure that they are seeing a dentist for regular checkups. All right, medications. We live in a world where people are on about 100 of them these days, it feels like. But there are over 500 medications that can cause dry mouth. And the most common ones that cause dry mouth that I have come into contact with are drugs that are targeted towards anxiety and depression, or patients who are undergoing chemotherapy or radiation for cancer treatments. Those patients tend to have the biggest dry mouth side effects. So when your mouth becomes very dry, you lose the saliva buffering effect. Our saliva actually lowers the pH in our mouth. Every time we eat something or drink something that has carbohydrates or sugar in it, we are causing a drop in that pH. So it's becoming more acidic. And the mouth kind of buffers that by raising the pH. So every time you eat or drink something that has sugar in it, the pH lowers to lower than 5 in your mouth. Your mouth is normally like a pH of 5. And anytime it gets lower than 5.5, it's a perfect environment for decay to form. So when you don't have saliva or you have lots of dry mouth, you have an increased risk of your pH being lower or more acidic. And also, the dryness on the teeth causes them to be more porous and more susceptible to bacteria being in them. So that's what increases the risk of decay. When people have dry mouth, we often see decay right up at the gum line, so right next to the gums of the teeth. Anticoagulants is another type of medication that we see a lot with dental implications. When a patient is on an anticoagulant, whether that be they've had a prosthetic knee replacement or they have a high risk of clotting, they've had any type of heart surgery or anything like that, we always go over their medical history with them and see if they're on an anticoagulant. One, because if they go off their anticoagulant, they could have, increased risk of stroke or heart attack. And two, while we're doing work, we do see an increased risk of bleeding for patients who are on anticoagulants. But then again, the American Dental Association does say that they want patients to stay on their anticoagulants as much as possible, even when doing dental surgeries. The American Dental Association recommends that if it's 1 to 3 teeth being removed, that the patient stays on their anticoagulant. And we also look at an INR when the patient is on an anticoagulant. So we refer and talk with the medical providers, cardiologists, or orthopedic surgeons a lot for patients that are on those. Another type of medication is anticonvulsives and immunosuppressants. Those two types, we actually see a lot of gingival enlargement with those medications. So if a patient is taking that, they may have swollen gums. The gums don't necessarily bleed, but could be growing over the teeth almost. So a lot of times we have to talk to medical providers and see if there's an alternative to those medications or a different type of medication that the patient could take. Steroids and inhalers are a big one, especially for high school, elementary age children with asthma. Chronic use of inhalers can cause fungal infections or thrush in the mouth. And we see a lot of candidiasis, is the fancy word for thrush, and have to treat that with antifungals. So it's always good to clean off those inhalers and try and prevent that as much as possible. And another medication that we often talk to patients about is contraceptives. When a patient is on a contraceptive, if we prescribe any type of antibiotic, they can be less effective when they're using that antibiotic. So it's always something we bring up to them about needing to talk to their provider about alternatives or using a backup form of protection if they're on an antibiotic for any dental infections. All right. So more general information. The biggest thing, if you're going to take anything away from this presentation, I would say is don't wait until you have pain to see a dentist. So if you know someone who is like, oh, my tooth's been hurting, or you see a patient later on and they're saying, oh, this is, giving me trouble, or it's really sensitive to cold, it's better to see a patient earlier than it is to wait. Preventative treatment is much easier. It's usually less painful, less invasive, less expensive, and you won't be as anxious if it's something small versus something large. So if there's pain, don't wait. Don't wait until you have pain. We usually recommend seeing patients every 6 months. So that 6 months is kind of like I kind of relate it to car maintenance. You don't want to, not get an oil change for a while and then have to pay for something more expensive when something breaks. You'd rather have routine maintenance to catch things before they get big. Also, some dental diseases are not painful, believe it or not. Gum disease, periodontal disease, usually doesn't hurt at all. I've had patients who have come in because they've lost a tooth and they're like, oh my goodness, I lost a tooth, but nothing's hurting. Why am I losing my teeth? And that patient probably hasn't been seen in, 10, 15 years and is also a smoker and maybe diabetic. And they have all these things that are cofactors with their tooth loss. So that's something that is good to know. Also, dentists can prescribe medications. A lot of times I hear patients say, well, I called my doctor because I needed an antibiotic because my tooth hurts. But that's something that dentists can do that I feel like a lot of people don't know about. We prescribe antibiotics, often antifungal medications, pain medications. There's a few others that we do as well. But that will help keep patients out of the emergency room if they know that they can come see a dentist first. And also, dentists should always be a referral source if a patient has any oral facial pain or swelling. The ER can definitely help them, but the dentist is going to be the one who definitively treats the problem, whereas the ER will normally treat just the symptoms of the pain. Also, something that we do on routine dental visits, those 6-month checkups and cleanings, is we screen for oral cancer and other systemic diseases like I talked about at the beginning of the presentation. A lot of times I can catch hypertension, diabetes, or even thyroid disease just from seeing a patient and getting their medical history and talking to them, even if they haven't seen another provider in a while. So, big takeaway: see your dentist every 6 months. Don't wait until you have pain, and that's the biggest thing. So the mouth isn't scary, I promise. You can look inside. Refer to your dentist early. Another thing I noticed while I was making this presentation is our dental office medical history form has a place where we ask about your primary care information, like if you see a doctor. We also ask if you've been hospitalized within the past year, and we have a full medical history and medications and smoking and Carrie's risk assessment, where we talk about like soda, sugared beverages, how often you brush your teeth, if you floss. But the biggest thing I think is that we do ask if they have a medical provider. I don't know, since I'm not in the medical field, if many physicians have this, but I feel like physicians should have a spot for, do you have a dentist, on their medical history forms. So that could possibly help in the future with referrals back and forth, interdisciplinary there. So it's really been nice talking to you guys. I hope that you've learned something from this and that you have maybe learned a little bit more about the mouth and that it's not so scary, and seeing how dentistry relates to different professions. So if you guys have any questions,